Well, good afternoon, everyone. I'm pleased to be joined here today by Brigadier General Janine Burkhead of the Maryland National Guard and William Huffner, the Chief Medical Officer and Senior Vice President of Medical Affairs at Shore Regional Health. We're here at the location of one of our new hospital-based testing sites, which is currently under construction, in order to meet the rising demand for testing and to divert people away from visiting hospital emergency rooms just to get COVID tests. Last week, we announced the launch of the first 10 new testing sites, and 8 of those locations are already fully operational, and the remaining 2 sites are going to open tomorrow. In addition to this site here at Easton Memorial, today I'm pleased to announce 5 more hospital-based testing sites, including Tidal Health in Wicomico County, Garrett Regional Medical Center, Holy Cross Germantown Hospital in Montgomery County, Howard County General Hospital, and Baltimore Washington Medical Center in Anne Arundel County. Our team is working around the clock to launch these sites in the coming days. They are all expected to be fully operational by the end of next week. As with the 10 sites that we opened last week, all 6 of these new locations will also be open 7 days a week, and they're going to help us keep our already strained emergency rooms and hospitals from getting overrun with people who are just trying to get a test. Maryland has now completed more than 17 million COVID-19 tests. We're administering an average of 63,000 tests every single day, which is one of the highest testing rates in America. Now, as we continue to ramp up testing across the state, we are redoubling our efforts to protect our most vulnerable residents who live in nursing homes. Nearly 70% of Maryland nursing homes are now currently reporting positive COVID-19 cases among residents and staff. While we want people to continue to be able to visit their loved ones, we will do everything in our power to ensure that they can do so safely. The Maryland Department of Health is issuing an order today which requires all staff, volunteers, and vendors who are regularly in the facility, regardless of their vaccination status, to be tested twice a week whenever community transmission is high. In addition, all visitors will need to provide a proof of a negative test or to be tested at the facility with a rapid test prior to entering. This order will go into effect next week, and we will be working closely with nursing homes across the state to make sure that all of the necessary testing resources are available to them free of charge. In addition, over the next few days, the Maryland National Guard will begin distributing courses of remdesivir, which is one of the therapeutic treatments which is effective against the Omicron variant, to institutional pharmacies that directly serve nursing homes. From day one of this crisis, we have taken unprecedented actions to bring our entire public health arsenal to bear against this virus. This includes procuring and distributing hundreds of millions of gowns, masks, and other PPE. Those efforts are continuing as we battle the current surge of the Omicron variant. And we know that Omicron is 4 to 5 times more transmissible than Delta and other previous variants of the virus. It is now the dominant strain in Maryland. According to our newest data, more than 95% of our state's most recent COVID-19 cases are the Omicron variant. To withstand this wave, we are encouraging Marylanders to continue doing the things that can keep us safe: getting vaccinated and boosted, avoiding crowds, keeping your distance, washing your hands, and wearing masks or face coverings when appropriate. Fortunately, Marylanders have followed the public health guidance more than in most other places. We continue to be one of the most vaccinated states in America. We have now administered over 10.6 million COVID-19 vaccines, and 92.9% of all Maryland adults have been vaccinated. And without any state mandate, we are ranked better than 45 other states for the percentage of people wearing masks. Next to getting vaccinated, and a booster shot, wearing masks is one of the best mitigation strategies that we have. And KN95 and N95 masks provide additional infection protection compared to cloth and general use face masks. So today, we want to make it even easier for Marylanders to have that extra layer of protection. So the Maryland Department of Health, with the help of the Maryland National Guard, will begin distributing 20 million N95 and KN95 masks all across the state at no cost through multiple channels. Beginning next week, N95 and KN95 masks will be made available free of charge through local health departments and at all state-run testing and vaccination sites. The Vaccine Equity Task Force, led by General Burkhead, will also partner with community organizations, including the NAACP, to distribute N95 and KN95 masks into the community. Masks will also be distributed to nursing homes all across the state and to all state agencies for their employees. We will keep taking actions to address this problem, and we are again urging Marylanders to remain vigilant so that together we can continue leading the nation with our health and economic recovery. Now at this time I'm going to turn the podium over to General Janine Burkhead to discuss their ongoing efforts to get COVID-19 tests and vaccines out to hard-to-reach communities.
Hi, good afternoon. Thank you, Governor Hogan. Good afternoon, all. Since Governor Hogan's appointment of the Vaccine Equity Task Force, we have worked nonstop with local health departments and community stakeholders to bridge the health divide throughout the state and increase Marylanders' access to the vaccine. We recently expanded our mission to include test sites at Anne Arundel and Upper Chesapeake. Since October 2021, the Equity Task Force has administered over tens of thousands of pediatric and adult boosters, distributed hundreds of test kits, and completed thousands of tests at both of the sites that I mentioned. We are now adding the distribution of N95 and KN95 to the Equity Task Force clinics. The Equity Task Force will continue to do all we can do by adding testing to our toolbox and max distribution, but we will still adhere to our first charge, and that is of equity and putting vaccine to arms of the community. We will continue to serve the sites throughout the state, libraries, faith-based institutions, nursing homes, community centers, and after-school clinics. If you haven't already done so, now is the time to consider getting your booster, your first shot, or your second dose of COVID vaccine. I want to thank the local health departments for working tirelessly with the vaccine distribution and now with the testing efforts. The Equity Task Force could not do it without them and their guidance, and thank you to Governor Hogan. The Equity Task Force stands ready to support and amplify all efforts. Please let us know how we can be of assistance. Thank you. Doctor.
Yep, thank you.
My remarks are going to be very brief. At the University of Maryland Medical System, we're seeing over 800 patients now hospitalized with COVID-19. At Shore Regional Health, nearly 50 patients are in our hospitals at this time. This is probably almost double of what we had seen in the past in terms of the total number of patients hospitalized. My biggest message, of course, is reflected in what the governor and the general said, having to do with becoming vaccinated and boosted, social distancing, mask wearing, and obviously good hand hygiene. But I would be remiss if I failed to express sincere appreciation, first and foremost, on behalf of our patients, the entire Shore Regional Health team that includes our CEO and chairman of the board. But thank you to the governor and to the General for their leadership and their proactive strategies to help bring the pandemic to a close. And ladies and gentlemen, without that collaboration and leadership, we would not be as successful as we are. Thank you very much.
Well, thank you very much, Doctor and General. And with that, we'd be happy to take a few questions.
Governor, regarding masks and the importance of masks as a tool in fighting the spread of the coronavirus, have you considered reinstituting an indoor mask mandate? It's kind of confusing. Some places have it, some places don't. Do we need a statewide order?
I mentioned earlier, we're number 5 in America on mask wearing, and we're much better than most of the states who have mandates. So I don't think we have any reason to change strategy since we're one of the best in the country and better than 45 other states.
Governor, you said, I may have misunderstood, you said 5 sites, but then you said 6?
I think there's 5 additional sites in addition to this one, so 6 this week, and then I think we'll do 4 more after that, and we'll finish up the 20 sites that we had talked about.
Can you, the ones that, the 8 that are open already, do you have an idea yet of how that will expand the capacity?
You know, I think it's doing really well. It's in different places doing different things, but I know there was a huge crowd at Laurel Hospital, which was one of the first ones where we did a press conference a week or so ago to announce the program. They're getting a lot of people through there. I know at Upper Chesapeake, they said there was a 72% reduction in the number of people in the emergency room because they're getting tested at the site out in front of the hospital as opposed to going into the emergency room to get tested. And that really was we wanted to get people. One was there's a huge increase in demand for testing. 63,000 a day. It's back to close to what it was at the very peak of the crisis before. We had been down to just a few thousand a day. So it's a huge increase. We're now able to help manage that. But it's also really taken a load off the hospitals who are so overloaded and overwhelmed. And I just want to take a moment. I know there's a lot of people here who are healthcare heroes. And I just want to thank, they've been through a heck of a lot for nearly 2 years now and working around the clock. And so some of these steps are to try to take the burden off of them. And I want to thank, the hospital for partnering with us. And I want to, really recognize all the folks that are standing behind us, the nurses and the doctors and the other healthcare professionals, along with the members of the Guard, our team at the health department. It's an incredible team effort. And everybody's just trying to get through this pandemic together. Anybody else?
Governor, can you talk a little bit about the funding that goes into making these projects possible?
Well, this is, just part of the overall effort. I mean, I don't know what the total amount that we've been able to spend, but it's a lot of both state and federal dollars that we've invested. Great partnerships with the private sector, with some of our hospitals, UMS in particular, this is a part of the system here, Shore Regional, and it's, they've done a number of them, but all of our hospital partners, private sector folks, our pharmacies, it's all, we've used federal dollars and state dollars, but there's also a lot of other people that have invested a lot of money in keeping people safe.
On the masks, the 20 million masks to be distributed, is this in addition to what the White House announced this morning, or is that part of it?
No, it has nothing to do with the announcement this morning, which I didn't see yet, but from what I can tell, they announced that they might be doing it, but not really any details. And it's sort of like, they also said there were going to be 500 million rapid tests, but we haven't seen any or gotten any detail on it. So I don't know when. That's terrific news if it happens and when it happens, but we'll be distributing our 20 million masks before that happens. Anybody else? It started this morning. They've made incredible progress, and I think it's going to be open, 17th? Yeah, should be completely finished and operational on the 17th. So we're going to try to get all of them open as quickly as we possibly can. But yeah, I give a shout out to the team here that actually was working on getting the site up. I thought when I came I might see a few pallets sitting in the parking lot here, but they're already pretty well along.
Governor, what's a reasonable expectation for people who are getting tested at these sites in terms of the turnaround for the results?
15 minutes.
Well, what about for
I don't know what the current numbers are, but they're, because of the huge demand and there's only so many labs or private labs that we work with, I think right now we're still getting a pretty good response time on them, but I really can't speak to what's happening with the supply chain. I know the rapid tests, we can do them right away, and that's been a huge effort in us screening to find out how many people have got the Omicron variant.
Build on that, I was gonna ask, there is across all the labs, the turnaround time for PCR results is ticking off and off. Will these states, do you believe that the more state-run sites could help lower the turnaround time overall in the process of one lab?
I'm not sure the more sites is going to lower the lab time. There are only so many labs. They're private sector labs, and they're overwhelmed with tests from all around the country. And we had that problem back in 2020. There's just not much you can do about that. But we're going to get people tested. The rapid tests give you the results immediately. And then, it's frustrating that they've got too many people going through those labs for the test. But, that's something maybe we can, try to work with the federal government on.
Last question?
Anybody else? One last one.
Is that an example of the mask?
This is, I don't know if this is exact same, I'm not going to give this one because it's kind of dirty, but this is a KN95. So we'll have N95s, which are a little higher up than that. And this is really, the cloth masks do provide some level of protection, but the tight fit around your nose and around your face like this really has multiples of keeping you safer. And with this variant being as contagious as it is, a lot of people say, well, I don't have a KN95 mask or N95 mask. I just have this cloth mask. So that's why we wanted to, we've got, 20 million of them out in the streets. It's going to take away that argument. All right. Thank you, everybody. Thanks, General.